The axis and atlas, also known as cervical vertebrae 1 and cervical vertebrae 2, are the first bones at the top of the spinal column near the skull. The articulation between these two bones allows the head to pivot from side to side. The atlas and axis are classified as both a synovial and pivot joint. This pivot joint is formed by the round end of the axis, known as the dens, inserting into the vertebral foramen of the atlas. The resulting rotational movement is due to the dens rotating on its own axis. One of the key characteristics that makes identifying these two bones easy is the absence of a body or a large flat portion of the bone. Because these two bones lack this body, the neck has the widest range of motion compared to the other sections of the spinal column. The superior articular facets are the surfaces of the bones that come in contact with the occipital condyles at the base of the skull. This articulation allows the nodding motion of the head. The lateral masses are the bulky solid parts of the atlas. This sturdy region supports the weight of the skull and is a site of attachment for the transverse ligament of the atlas. The transverse ligament is responsible for keeping the anterior facet of the atlas up against the dens of the axis. In between the lateral masses is the vertebral foramen. Lateral to it are the transverse foramina, which are located on the transverse processes. These foramina are exclusive to the cervical vertebrae and are the location for the vertebral arteries, veins, and sympathetic nerves which travel to and from the head. Both of these structures are shared by the atlas and axis as well as all cervical vertebrae. The anterior arch, the smallest arch, projects in an anterior direction. This forms the anterior tubercle, which is the site of attachment for the anterior longitudinal ligament. The anterior longitudinal ligament runs down the anterior surface of the spine. It anteriorly traverses all of the vertebral bodies as well as intervertebral disc. The posterior arch, the larger of the two, projects in a posterior direction. This forms the posterior tubercle, which is the site of attachment for the ligamentum nuchae. This posterior tubercle also serves as a rudimentary spinous process, since there is no true spinous process of the atlas. On the inferior side of the atlas are the inferior articular facets. They are rounded in comparison to the anterior facets, which are elongated. These facets articulate with the superior articular facets on the vertebrae below it. This is seen in all other vertebrae as well. When viewing the atlas inferiorly, the facet which articulates with the dens can be seen. This articulation between the dens and the facet creates a pivot joint. The transverse ligament helps to stabilize the atlantoaxial joint, and the articulation between these bones is what allows the skull to pivot from side to side. The axis is distinguishable from the atlas based on the ontoid process, also known as the dens. It is the most prominent rounded superior projection of the axis. The dens forms a part of the atlantoaxial joint. The atlantoaxial joint is made up of the ontoid process, the posterior surface of the anterior arch of the atlas, and the transverse ligament of the atlas. The second distinction of the axis is the prominent spinous process, a feature lacking in the atlas. The spinous process is seen on cervical vertebrae 3 through 7 and all other vertebrae as well. This process projects posteriorly in an inferior direction. Anterior to the spinous process are the lamina, which are smooth surfaces closest to the vertebral foramen. Superior to the lamina are the superior articular facets. These flat facets articulate with the inferior articular facets. Lateral to the superior articular facets are the transverse processes. They are significantly smaller in size compared to the transverse processes of the atlas. When viewed inferiorly, the most prominent distinction of the axis is the thick base, the body. On the posterior distal end is the bifid spinous process, with two divisions of unequal size. It always faces posteriorly and projects inferiorly. On the anterior side are the transverse foramina and the transverse processes, which are smaller than the transverse processes of the atlas. Inferior to the transverse processes are the inferior articular facets, distinguishable flat surfaces which articulate with the third cervical vertebrae. Can you pause it? When the axis and atlas are articulated, the dens allows the axis to move in a pivoting motion. The resulting articulation is the atlantoaxial joint, which allows flexion and extension of the head. When in a motor vehicle accident, hyperextension or hyperflexion of the head can result in dens fracture. A dens fracture can result in avascular necrosis, the death of bone tissue due to a lack of blood supply, and requires extensive recovery time. There are 4 different types of cervical vertebrae fractures. 1. Fracture of the atlas or Jefferson fracture. 2. Hyperextension or whiplash. 3. The hangman's fracture. And 4. Fracture of the dens. The most significant type of atlas fracture is the Jefferson fracture. It is often accompanied by neurological impairment. The Jefferson fracture occurs when there is significant force which ruptures the transverse ligament of the atlas. 2. When the head is whipped back on the shoulders, it results in hyperextension or whiplash. The fracture associated with this injury can occur to any of the cervical vertebrae. This type of injury is most often seen in rear-ended vehicle accidents, as it is due to a sudden compression by rapid deceleration. In severe cases of hyperextension, the axis becomes dislocated from the body of the In severe cases of hyperextension, the axis becomes dislocated and the body of the axis moves anteriorly with respect to C3. This sudden and violent dislocation can result in spinal cord injuries that may result in quadriplegia or death. 3. The hangman's fracture. The hangman's fracture is a direct result of a sudden deceleration that corresponds with hangings. This type of fracture is particularly lethal due to the force involved and the loose fragments from the fracture, which can rupture the spinal cord. This results in respiratory and cardiac failure and even death. 4. Fracture of the dens. Fracture of the dens are most commonly caused by traffic collisions and falls. This type of fracture is often unstable and is at high risk for bone tissue death. This fracture often requires extensive healing time compared to Jefferson's fractures. This video was created to fulfill the requirements for Biology 11 Human Anatomy at Saddleback Community College.